How to communicate with a woman in the postpartum period. It is extremely important to support a mother in the first weeks of motherhood. As a result of the feedback and observations from mothers, it is seen that women who are mothers in urban life experience a greater sense of loneliness compared to women in rural life. The most important reason for this is that urban life provides limited opportunities for family cooperation. If the population within the family is small, the limits of this cooperation become even more pronounced. The old saying "it takes a village full of people to raise a child" clearly expresses how important cooperation is in this sense. For this reason, we can say that the most important person who can support the mother, especially in urban life, is the father and the family. At this stage, we will talk about effective communication, information on how to communicate effectively with a woman in the postpartum period to support her well-being, promote trust and meet her needs, as well as sample communication techniques. 1. Show empathy and understanding. Why is this important? The postpartum period can be overwhelming due to the physical and emotional changes a woman undergoes. Empathy demonstrates that you care and are willing to understand her perspective. How to show empathy? Acknowledge her emotions. Let her express feelings freely without fear of judgment. She may experience joy, anxiety, or even sadness, all of which are valid. Example: "It's okay to feel a mix of emotions right now. I'm here if you want to talk." Validate her experiences. Reassure her that what she's feeling is normal and shared by many new mothers. Example: "A lot of new moms feel this way. It's a big adjustment, and you're doing great." 2. Use positive and reassuring language. Why is this important? Positive reinforcement can help build her confidence in her new role as a mother and encourage a sense of accomplishment. How to be reassuring? Avoid criticism. Frame suggestions in a positive way. Example: "Instead of saying, 'You're not holding the baby right,' say, 'The baby might feel more comfortable if you try holding her like this.'" Praise her efforts. Highlight her strengths and reassure her that she's doing a good job. Example: "You're so attentive to the baby's needs. It's clear how much you care." 3. Listen actively. Why is this important? Active listening helps postpartum women feel heard and understood, which is crucial for emotional well-being. How to practice active listening? Give full attention. Minimize distractions, like phones or TV, when she's speaking. Paraphrase and reflect. Repeat back what she says to show understanding. Example: "It sounds like you're worried about breastfeeding. Is that right?" Ask open-ended questions. Encourage her to share her thoughts and feelings. Example: "What has been the most challenging part for you so far?" 4. Address physical and emotional recovery. Why is this important? Postpartum recovery is a multifaceted process that affects physical health, emotional stability, and mental well-being. Open communication can help identify areas where she may need support. How to address recovery? Check on her health. Ask about her physical recovery, e.g., pain, sleep, energy levels, and emotional state. Example: "How are you feeling physically? Is there anything that's still uncomfortable?" Check on her health. Watch for signs of sadness, anxiety, or withdrawal that persist for weeks. Encourage professional help if needed. Example: "I've noticed you seem a bit down lately. Would you like to talk to someone about how you're feeling?" 5. Offer practical support. Why is this important? Practical help can ease the overwhelming responsibilities of caring for a newborn while recovering postpartum. How to provide support? Check on her health. Instead of assuming, ask directly. Example:
Would you like me to watch the baby while you rest?
Simplify decisions. Offer clear options to avoid decision fatigue. Example:
Would you prefer tea or coffee?
6. Respect her boundaries. Why is this important? Postpartum women may need personal space to process their experiences and bond with their baby. How to respect boundaries. Avoid unsolicited advice. Only offer suggestions if she asks for help. Example:
If you'd like, I can share some tips that worked for me.
Give her space. Respect her need for privacy or quiet time. 7. Communicate inclusively. Why is this important? Postpartum women often rely on a network of support. Inclusive communication fosters collaboration and shared understanding among caregivers. How to be inclusive. Involve her support network. Encourage open communication with her partner, family, or friends. Respect cultural practices. Understand and honor her preferences and traditions related to childbirth and postpartum care. 8. Reinforce her bond with the baby. Why is this important? Encouraging her bond with her baby fosters confidence and emotional connection. How to respect boundaries. Support her confidence. Highlight her unique ability to care for her baby. Example:
Your baby is so calm when you hold him. He feels safe with you.
Celebrate milestones. Acknowledge small successes, like the baby's first smile. Example:
The baby's smile today was so beautiful. You're creating such a happy environment for him.
9. Be patient and flexible. Why is this important? Postpartum recovery varies from woman to woman, and her needs may change daily. How to show patience. Adapt to her needs. Be prepared to adjust your support based on her emotional and physical state. Avoid rushing her. Let her recover and adjust at her own pace. 10. Encourage professional help when needed. Why is this important? Some postpartum challenges require specialized support. Encouraging professional help ensures she receives the care she needs. How to encourage help. Connect her with resources. Recommend lactation consultants, postpartum support groups, or mental health professionals. Example:
If breastfeeding feels overwhelming, there's a great lactation consultant I can recommend.
Example conversations. Partner to postpartum woman:
I know you've had a busy day with the baby. Why don't I take over for a while so you can rest or do something you enjoy?
Partner to postpartum woman:
You've been through so much lately. How are you feeling physically and emotionally? I'm here to listen or help however I can.
Healthcare provider to postpartum woman:
Many mothers feel overwhelmed during this time. Are there any specific concerns you'd like to discuss, or would you like information about local resources?
Postpartum communication requires empathy, patience, and sensitivity. By actively listening, using positive language, respecting boundaries, and providing practical support, you can create a nurturing environment that helps postpartum women feel valued, understood, and empowered during this transformative period.